Hello everybody. Today we're going to do a practical demonstration on preparing a patient for a Holter monitor. Here's all the equipment we'll be using. We've got the Holter monitor itself, AAA battery, alcohol wipes, the chip that goes into the Holter monitor. It's just like a camera card. The electrodes, the shoulder holder, and the packet that we put the monitor in. My name's Jennifer and I'll be introducing my trainee in a moment, and we'll get started and show you the demonstration. Okay, as you just saw, this is our demonstration program that we follow. It shows all the electrode placements. This is Heather. Heather's going to be the learner today, and this is the model that we're going to be using. What I have done is just loosen this a little bit. You don't need to undress the patient to place the electrodes on, and especially with a woman, we don't take the bra off, we leave the bra on. I've washed my hands, have my PPE on. So now what we do is use the alcohol wipe, and as you can see on the chart here, we're placing one electrode right in the top of the sternum there, which is here on our patient. So I've just wiped to get rid of any sweat, powder, creams, anything like that off the patient. Now I've opened another alcohol wipe. As you can see, we're going on the 6th rib down here, which is going to be here. So we've just wiped him there. You need the alcohol wipes and where you've placed the alcohol to dry before you put the electrode on. That's why we do all of this first. Now with the left hand side placement of the electrodes, I always center where the nipple is. And you can see the orange electrode is going to go here onto the side of where the nipple is, and then we've got the red electrode is going to go onto the other side of the nipple. So I wipe there. Just have one more to go. This Holter monitor is actually a 5 lead placement. You can get 7. But the most common at the moment is 5. And the other one that we're going to do is down the bottom here, which is on the 8th rib, which is down here on our model, and we're just going to wipe that with the alcohol wipe. Now all of those spots are dry, I'm going to start up here again, and here's our leads. So with the leads, always like an octopus. The white one is the white one which goes in the center of the collarbone up here. So here's the electrode. Because these are actually being placed on the bone, it's a lot easier to click it on before you put it on the patient. Then you're not hurting the patient. The plastic just peels off, and it's very good at sticking to your gloves. And then we just feel there, that's the bone, and then we place it on the patient like that. Pop the rubbish in the bin. The next one we're going to do is the red one, which is on this side of the patient's nipple. So we find the red lead, which is here, clip it on, it's just like a press stud. Clipping it on, peel him off, just feel for the rib, which is there, place it on, and just a gentle push and make sure that it's on the patient properly. Next one we're going to do is the orange one. There's the orange electrode. Pop him on. Now what this actually is going to do is a 24-hour recording of the patient's heart. This is the rib here. It's the orange one just there. So we're going to place him there. In last lessons we've organised a ECG on a patient, which has been only for a couple of minutes, but this one is a 24-hour reading. Now this is the green electrode, which is actually going on the 8th rib. All the same process. Clip him on, peel that off. This one's actually quite low. It's right down at the bottom of the ribs, which will be down here. So you place it on. And we only have one to go, which is the brown one, which is there on the right hand side of our patient. Same process. Click it on, peel it off, and it's actually diagonally opposite to the orange one, so you just place it there. Now that's how the placement is. Now what we do is pop the shoulder strap around the patient. It's a lot more comfortable, the shoulder one, than what it is to have the waist one on. It's easier to maneuver. And we pop the straps. There's two little holders there, so we just pop this on. Bearing in mind the whole time we're dealing with the patient, we leave our gloves on, and then we just ensure with the patient they're comfortable with that. Quite often we ask a patient to have a singlet or a tight t-shirt on underneath, which helps control these leads. But with our friend here, we've just left it off so you can see what's going on. Now this is a little recorder. Now what we do is take the back out. Just slides like that. We pop the disc in with the gold side down. It just pops in like a camera. Then we have to pop our little battery in, and you can hear that little beep. That's saying that it's started the wipe the disc. Just pop that on like that, and we ensure that we pop this in properly. You need to push in the two little sides there, and this triangle must line up with the dot on the front of the machine. So we just do that, and you'll hear a click, and then you can see the red light, the green light is on. If it is an orange or red, that means that the battery's not working properly and you need to swap the battery. What we will do now is hold it, and you can hear those three beeps, and now you can see that the light is flashing. That means that the recorder is actually recording this patient's heartbeat. We show that to the patient so they know that that must be seen all the time. So what we do now is just pop him in the machine, in the little holder there. Do the zipper up, and we have a little press stud here which keeps it all through, keeps it all nice and safe, and that just stays like that. So you can see again, we followed the chart, everything's right, patient's comfortable. We're just going to do his shirt back up. We can't send him out in the street like that. Patient needs to come back in 24 hours time. There is a special diary that they need to write on. which will be in another lesson. And there we are. He's all fine to go and come back and see me in 24 hours time. Welcome back. Now Heather's going to have her turn of placing the electrodes onto our patient. I am just going to hold the chart here, same as what Heather did for me, and I have my PP on just in case Heather needs a hand. Heather's already washed her hands and got her PPE on. So, let's get started.
All right, Jennifer. So I can go ahead and open up his shirt?
Yes.
Okay. There we go. And then we're going to take an alcohol wipe. We'll take a couple because we'll need a couple, correct?
Yes.
Okay. All right. Put my glasses on here, I think. Okay. So I'm going to have a feel. We're just about there. Give him a wipe. Now, can I use this one to wipe again? Or do I need another one for each one we do?
Probably best you use a new one each time.
Okay.
Yes. So why do you think we are wiping the alcohol wipe on the patient?
That's just to get any creams that they have on or powder or if they've been sweating at all.
Yes.
It just makes them nice and clean so that
Perfect.
the our little stickies will stick to them.
Okay, no
Okay.
worries.
All right, and then I'm going to go down to the 6th rib. Gonna feel, and I'm right in here. I'm gonna give it a little wipe.
Also, with this patient being a male, he has no hair on his chest. Sometimes we do have to shave our patient just to where the electrodes are going, but luckily with this one we don't have to. We've just got 2 alcohol rubs to do. And whenever we do this on a patient, we always refer to the chart. It just ensures competency and efficiency, and that there's no room for error, and that the patient won't have gone through 24 hours with a monitor on for no reason.
Okay, we've got him all wiped down, and I'm happy with
Perfect.
how his skin feels. So it's all prepped and ready to go. Okay, so I'm going to take a look here. So we're white. Hopefully I don't get them all tangled up.
I always call this an octopus.
So we've got the white one, and we're going to clip that in. Push that hard. Take that off. Have a little feel. Oh, you're right. They do get really sticky to your gloves. Okay, and I'm just going to push that right there. Okay.
Perfect.
Now we're going to do the red one, which is number 6. I just want to remember again where I'm going, right down to the 5th. That off. A little feel. I'm just going to stick that right there.
Perfect.
Oops, there we go. Gotta do this first, my little orange one.
Do you find it easier working with the chart beside you?
It is so, that chart is amazing. It's really, really good and helpful. So I'll take that off. Let me just have another little feel. Sorry, I hope I don't knock you over there. I'm just gonna place that one right there. And then we're going to do the brown. Does it matter what way I do this? If I did that one first,
No,
does it really
doesn't.
matter?
No.
Okay.
No.
All right.
Not at all.
Okay, so put this one.
Placement's the most important, not what order it's done in.
So you can put that about there.
Making sure too that the patient's comfortable. Some patients get worried that we're setting them up with all these electric things.
And green.
Patients not allowed to stand in front of a microwave with a Holter monitor on. They're also not allowed to lay on a electric blanket. it can do things to the machine.
Is that all right about there, Jennifer?
Yes, that'll be fine with this patient. Yes, all good.
Now, what if you're a little bit off? Because everyone's a little bit different. Like, what
Yeah,
if
every patient's different.
Okay.
So it's purely what is right for this patient.
Okay.
Okay. So now we need to attach everything to him.
All right. So should I start with putting the strap around his neck?
Yes, I think so.
Okay.
Just hold him on.
Yep. So we basically kind of already placed that. It's going to go up. Excuse me while I get up around your neck here.
I can stay behind.
Yep. All right. And that's in. Then we come down.
And
Got this one here.
yes, it should be just in there.
I'm just going to set those there.
You find him?
Found it.
Found it. And we already have the little pouch attached for you.
Yes.
So
thank
it's
you.
easier.
Okay, so there's
Perfect.
that. Now I'm going to come down to the device, to the actual. All right, we're going to take the back off. And the disc, you said the gold goes to the bottom, the brass. So we're going to put that in. Little
Perfect.
click.
Perfect.
And then our battery, make sure it's going in the right way.
And that
done.
little bib is perfect.
All
Now
right.
we do the placement.
Okay. Should I put this in first and then plug this in, or does it
Whichever
matter?
suits you.
Okay.
With this holder, it's perfect because you can do it.
All right. So I see the arrow here,
Yes.
and that has to match up with the dot. And I press these two things.
Perfect.
And now I hold it.
Heard the 3 bips.
Heard the 3 beeps.
And your light is flashing, so that's
Flashing.
perfect. It's doing the recording.
And then we can put it into the case.
Yes.
Do it up.
Perfect. And then we can just make sure that the patient is set up correctly. Do his little shirt up.
Comfortable. Okay, just let me get your shirt done up for you, sir.
That's perfect. And now the patient will come back and see Heather in 24 hours to have all of this removed, and they bring back a diary if they have any events with the heart, palpitations, stress, tightness of the chest, anything like that. And that's all written on the diary, which goes with the disc. Okay, welcome back. It's Tuesday morning. Simon's come back to have his Holter monitor removed. Heather's here, going to remove the electrodes, send the diary and the chip away to North Ryde to have the disc read. And we've both washed our hands, got our PPE on, and so let's get started. Hello, Simon.
Hi, Simon. How are you today?
He's been very good and brought his diary back.
I'm just going to undo your shirt here so we can get at everything and get this off of you so you can go home and take a shower.
Yes, very important. Because when the Holter monitor is on the patient, they can't have a shower or bath or swim or do any physical activity that is going to make the electrodes fall off. So patients are usually hanging to have a shower when they come back. Okay, so where would you like to start, Heather?
Now, I just have a quick question.
Yes.
Should I take the tabs off together with this, or do I take the electrodes off first and then take that off? Does it
Whichever
matter?
is more comfortable with you.
Okay.
If you like, possibly disconnecting the machine first.
Okay.
And then
And then
not
we'll do this.
disturbing that.
Okay,
Yes.
perfect.
Yeah.
So I can just go ahead. Do I have to push the button to stop it?
No.
Okay.
No, you just need to unloosen that.
Yeah. I need to put my glasses down again. Okay.
Yeah. And then remember, when you're taking this off, you need to squeeze in to
Okay.
allow it to come out. And the good thing is the light is still flashing, so that's wonderful. that everything's worked perfectly. The battery has lasted the full 24 hours.
Okay.
Nothing has happened, so the
Okay.
recording should be perfect.
Okay.
So just squeeze in like you did when you placed it in and pull him out.
Can I go overhand? There we go.
Perfect. Okay, if you like, we'll leave that there.
Yeah.
Take all of this off
Okay.
and
Sorry.
make our patient very happy.
This may give you a little wax job. There's one.
They are a little bit awkward to get off because they do need to stay on for 24 hours. Right, I'll hold them for you.
Okay. Sorry, Simon, we're just about there. You're doing a good job. Let me try this one from this side. Sorry. Stuck that one on
Bit
really well.
sticky.
There we go.
There's your alcohol wipe just to wipe the gel off. The pads actually have a little bit of gel on them, so it's always nice to wipe a bit off and then the patient won't be sticky.
Okay. There
One's
we
enough?
go.
You don't need another
No,
one?
I think he's good.
Perfect. So what we need to do is take the shoulder strap off.
All right, sorry. Gotta better get these off. Okay, so shoulder strap off.
Perfect. Perfect.
There we go.
And we just double check that we've wiped everything. Patient's fine. Perfect. So we can do his shirt back up.
Okay.
And now he can go home and have a shower. He was very good, Simon. He looked after the machine properly.
Thank you, Simon.
Now, what we will do is just take the chip out of there
Okay.
and then we can send it away. So very carefully, we just need to take the back off again.
Okay.
And then we need to turn the machine upside down so
Yeah.
the battery will flick out. Are you able to get your fingernail in there?
Yes.
Perfect. And then you just push in like you do with a camera. And there's the little disc, comes out. And that's what we send away to North Ryde to get read. That's the 24-hour recording of this patient's heart.
Okay.
Heather, have you got any questions on the process?
No, I think that was perfectly explained. Thank you so much.
You're welcome. Simon's happy. He brought everything back, which is good. Didn't wet it or anything, which is always a bonus. Thank you very much, everybody, for your attention. Thank you, Heather. It was
Thank
a good
you.
lesson.
Yes,
I
thank
think
you
everything
so much.
that we planned has worked out, and Simon's had his Holter monitor recording done. Have a good afternoon, and thank you.